Today, we're tackling an essential neonatal topic, respiratory distress syndrome, RDS. Imagine you're in the NICU and you see a preterm baby struggling to breathe. What do you think might be causing this distress? That's right, it's often due to RDS, a condition that demands immediate attention and precise care. Let's break it down step by step. A. Description. Instructor, RDS is a serious lung disorder, and here's the root of the problem. 1. Immature lungs. Preterm babies haven't fully developed their lungs. 2. Lack of surfactant. Surfactant is like the oil that keeps the lungs' tiny air sacs open. Without it, the sacs collapse, causing breathing difficulty. 3. Hypoxia and acidosis. The baby can't get enough oxygen, leading to low blood oxygen levels, hypoxia, and a buildup of acids in the blood, acidosis. So when you see a preterm baby with RDS, think of it as a lung mechanics issue, a car engine struggling without oil. B. Assessment. Instructor, your first job is to assess the baby thoroughly. What signs will you look for? Let's visualize this. Visual aid. Display an image of a newborn with RDS, highlighting symptoms. 1. Respiratory distress. Tachypnea, rapid breathing. Nasal flaring, like the baby's trying to pull in more air. Grunting sounds with exhalation, a sign the baby is working hard to breathe. Chest retractions and seesaw breathing. The chest and abdomen move oppositely. Apnea, periods when breathing stops altogether. 2. Skin color, pallor, pale skin. Cyanosis, bluish tint to the skin and lips. 3. Temperature, hypothermia. These babies struggle to regulate their temperature. 4. Muscle tone, weak or floppy muscle tone due to low oxygen levels. Instructor, all right, class, let's connect the dots. Why do these symptoms happen? RDS disrupts the baby's ability to oxygenate effectively. Now, how do we intervene? Let's gear up for action. See interventions. Instructor, here's where you, as future nurses, step in to save lives. Let's discuss the key interventions step by step. 1. Monitor and maintain airway function. Keep an eagle eye on the baby's color, respiratory rate, and effort. This tells you how severe the RDS is. Support breathing as prescribed. This might include oxygen therapy or even mechanical ventilation. 2. Oxygen therapy and blood gas monitoring. Check arterial blood gases, ABGs, and oxygen saturation levels regularly. But here's the trick. Use the lowest oxygen concentration necessary to avoid complications like retinopathy of prematurity. Speaking of RUP, any baby needing oxygen should get an eye exam before discharge. Positioning. Position the baby on their side or back with their neck slightly extended. It's a simple but effective way to open the airway. 4. Respiratory therapy. Use gentle percussion and vibration to loosen mucus. Fun fact, you can use a padded electric toothbrush for vibration therapy. Innovative, right? 5. Nutrition and bonding. Ensure the baby gets adequate nutrition. It's crucial for recovery. If they can't breastfeed, encourage the parent to pump milk for later use. Breast milk is a powerful immunity booster. Support bonding through skin-to-skin contact, kangaroo care, if the baby's condition allows. 6. Parental involvement and education. Involve parents in every step of care. Teach them what to expect, how to handle oxygen dependency if needed, and how to recognize warning signs at home. 7. Administer surfactant therapy. This is the game changer. Surfactant replacement therapy. It's instilled directly into the baby's lungs through an endotracheal tube. Think of it as giving the baby's lungs the oil they desperately need to function.